Let's talk about dysthymia. Is it dysthymia? That's how you
Yeah,
say
and
it?
it's called persistent depressive disorder now in the DSM-5.
Got it. Okay. So I've heard dysthymia. I have not heard the PDD acronym before. What is that?
So dysthymia is somebody who has depression, but at a more lower grade level. It tends to not be as severe as a major depressive disorder in terms of the symptoms, both in number and in terms of severity, but it does go on for much longer. And so in order to qualify for a persistent depressive disorder diagnosis, you will have to have had most of the symptoms, most days, more often than not, for at least a 2-year period.
Goodness.
Yes. And so in some ways, it's a almost ignored pattern of depression. People sometimes just think that this person's being negative, but actually they have persistent depressive disorder, and that needs to be treated as well. I think sometimes it also escapes diagnosis because it's actually much rarer than major depressive disorder. So the prevalence of major depressive disorder at any given time is about 7% of the population, whereas for persistent depressive disorder, it's more like 0.5%. So I think sometimes people aren't thinking about that, and they don't know that something like persistent depressive disorder can actually wreak a lot of havoc on individuals. And there's even a smaller subset of people who have both major depressive disorder and persistent depressive disorder. And what that means is in between the significant and more severe major depressive episodes, they also have an underlying sort of sadness that is low grade and lasts for more than 2 years at a time.
For someone who has PDD and major depressive, how do you begin to treat that?
So it's more difficult, and individuals who have what we call double depression, both diagnoses, do have a lower recovery rate and a much higher recurrence rate. And that's because when the major depressive disorder is resolved, they still have the persistent depressive disorder to deal with. And so sometimes the medication strategies will have to be altered depending on which one they're dealing with, whether it's the major depressive disorder or the persistent depressive disorder. Oftentimes they will need more structured behavioral interventions, and they will need to be in therapy longer because you have to address both. So when you're not fully depressed, as in a major depressive disorder, you are still having that low-grade depression that prevents you from doing things, maybe gets into the way of your motivation, impairs your concentration and functioning, and makes you feel bad about yourself. And so I think those require more of a long-standing treatment approach so that these individuals are oftentimes in therapy a little longer than somebody who just has one of the conditions.
This PDD diagnosis is really interesting to me because especially in our current time of constantly comparing our lives to the unreal lives on Instagram and social media, it wouldn't surprise me that a lot of people would hear PDD and think, oh, that sounds like me, because it seems like everyone else is loving it, never has a bad day. Meanwhile, we know that we do have bad days, but it only is 0.5% of the population with PDD. So how can someone determine if they really have PDD or they're just falling into a comparison trap?
Yeah, and I think that's really important to talk about because sometimes people will say, well, in general, I'm kind of a cynical person. Does that mean that I have PDD? No. When you have persistent depressive disorder, it's actually impacting you at a significant level. You have significant clinical distress, or it's impairing you in one of the major areas of life, whether it's work, social relationships, romantic relationships, or the like. If you just feel like, in general, you're a little bit more cynical, maybe you see the negative side of life a bit more, but in general, you're still able to function, get up every day, and still be able to go about your day with little problems, you do not have PDD. It's interesting because people have actually talked about this theory called depressive realism, that some individuals are a little bit more prone to feeling depressed from time to time because they're realistic. And in fact, people who are not as prone to depression are actually a little, maybe too rosy colored glasses. Maybe it's almost like they just expect things to work out, and that's why they're not so depressed. And so it's an interesting theory that not everybody agrees with, but it's sort of this idea of if you actually make contact with the real challenges of life, you're gonna feel depressed from time to time.
Right.
And that's kind of the idea. And so this is not somebody who, you know, generally kind of has a little bit more cynical view to life, or every once in a while they have a couple of depressed days. We're talking about somebody who, for 2 years, for more days than not during those 2 years that they have these symptoms of sadness and low-grade depression that impairs their functioning or is extremely distressing to the individual. And that's when we should consider a PDD diagnosis.
How does, I hear all the time that depression and anxiety co-occur together almost more than any other two mental health conditions. What is the role of anxiety for somebody living with PDD?
The role of anxiety for someone living with PDD is oftentimes their judgment on themselves. Oftentimes they're feeling like, how come I'm not getting better, right? Because again, in some ways, somebody with persistent depressive disorder, it's even more difficult to manage because you're always a little depressed. And so I think that sometimes the anxiety will play a role. And in fact, that is one of the specifiers of both major depressive disorder and persistent depressive disorder, that when it's clinical enough, that there is a specifier called with anxious distress. And what that means is this is somebody whose depression co-occurs at the same time as their anxiety symptoms. And because the two are so interrelated, sometimes you find individuals whose depression and anxiety are really discrete diagnoses, like maybe they have a generalized anxiety disorder and a major depressive disorder. And then you have individuals who just have a few anxiety symptoms, like feeling on edge, being keyed up, having a lot of worries, difficulty concentrating, that accompanies their depression every time they have an episode. So we talk about those individuals as a specifier of with anxious distress that co-occurs with their depression condition.
If you are talking with your therapist and the therapist says, look, Kyle, I know you think you have PDD, but I'm telling you, you don't. It's this. But you really believe it's PDD. At what point should you say, you know what, I'm not the doctor, they're probably right? Or should I move on and get a second opinion?
I always think it's helpful to get a second opinion.
Really?
I always do. And I think it depends on your therapist's specialty. Some therapists really do review the DSM, keep up with the research, and really understand these finer points of diagnoses. And other therapists don't. Other therapists are just more focused on dealing with the symptoms, and they don't actually invest as much in the diagnostics of the condition. And so you may need to move on to somebody who does that for a specialty. So many psychiatrists would say that they are excellent diagnosticians. A neuropsychologist would be an excellent diagnostician, but sometimes therapists who do mostly work on an individual level, individual basis of therapy, they may or may not concern themselves as much with the exact diagnosis that you have.